Alright, so this is how I make my concept maps. This patient is made up. There's no specific person that this is about, just going off of an example. So to begin, I usually start with my related medical diagnosis. This is going to be your admitting diagnosis or their primary diagnosis, whichever your patient has. From there, you're going to do your concept. That's going to come off of your MOV sheet from orientation. It's going to have like mobility and safety and protection, that kind of thing. So osteoarthritis relates mostly to mobility, so that's what I put here. From there, I go to our Lippincott Advisor website. You just click on the Lippincott. You're going to go to diseases and conditions. So you can either go this way and find osteoarthritis, or if you want to type it, you could put it in here, whichever is easier. So you'd scroll down, look for assessment. So you can do anything under history or physical findings. This box basically is for if a patient comes in with osteoarthritis, these are going to be the main focus points that you're looking for. It's not about anyone specific. It's just anyone that comes in, this is what you're going to assess for. Common findings or history. So you can pick 10 of these. The 10 that I chose for this one was decreased range of motion, like muscle atrophy, gait abnormalities, joint instability, that kind of thing. Then from here, once I get that done, I go over to patient presentation. So this is going to be from your patient, what they came in with. So for my example, I did the patient's chief complaint was acute and chronic joint pain, and specifically in the hips and the knees. So for the assessment data, that's going to be what we see in the patient as we're doing our assessment. So he has decreased range of motion, pain. I could have used a pain scale here, use of cane or power chair. So I'm putting in that he has a gait abnormality that requires an assistive device. Basically anything that can contribute to your nursing assessment. If I put patient has congestive heart failure, I don't think that would qualify because it's not relating to osteoarthritis. You can use your medical diagnosis in here as long as it relates. You can do subjective data as long as you have proof. So I guess it would be like patient states hip pain or something like that. And then from here, I typically go this way. So relevant test and diagnostic labs. I did DEXA scan, which is a bone density scan. That's going to screen for osteoporosis. And then x-rays to see if they have any decreased joint space or something like that. Any of the tests or labs that are going to relate to looking at osteoarthritis. From there, I usually jump up here since we're still looking at the patient and what kind of treatment or relevant medications are they on for osteoarthritis. This patient could be on HCTZ, Lasix, Voltaren, and amoxicillin. The only one that I would put for this situation would be Voltaren because that's the only medicine that would relate to osteoarthritis. Also, physical therapy and occupational therapy. His situation, physical therapy for joint range of motion and all that. Occupational would be for like ADLs and that kind of thing. From there, I just go down here. Worst case scenario, every worst case scenario is death. So we're advised not to put death because that's really generic. So we want to think kind of outside of the box. If you put death, make sure to put something else as well. So I put that he would need a joint replacement, or maybe it would become septic, because those are complications prior to death. We don't want to get to that point. But of course, that's always a possible effect. From there, you pick 2 nursing diagnoses. So I got this from our diagnosis manual. In the very back, when you look at arthritis, it says or osteoarthritis rather, it says to go to arthritis in our book. So I went there, and then it takes you to page, sorry, I thought I had it blocked off. It is going to take you to arthritis, and on page 955. So you could basically pick pretty much anything. You can go from rheumatoid because it's going to be pretty much the same as far as your nursing diagnoses go. So for this one, I chose impaired physical mobility and acute or chronic pain. From there, you choose 10 different things that your patient presents with that backs up why the nursing diagnosis of physical or impaired physical mobility would apply. So he has a sedentary lifestyle, so he's got decreased like muscle mass and that kind of thing. He's got decreased range of motion, which would make it harder for him to move. He's over 70 years old, also same thing. You can include your medical diagnoses in here, and you can include like your pain scale and that kind of thing. Same thing for chronic pain. Just go back through the patient chart, see what can kind of go side by side with the chronic pain and what could be causing it. Or effect of it, because constipation, if he's in chronic pain, it's going to slow everything down in his system and he's going to have constipation. So from there, you would go to the next page in the concept map, which is going to look like this. You only have to put 1 nursing diagnosis down, which would be the impaired physical mobility. So that's where you would go to page 537 in the nursing diagnosis manual. I tried to pull it up on my computer, but it's not downloading right. From here, you could go, there's at the bottom of page 537 in the diagnosis manual, it says nursing priority number 1, and that's to identify the causing and contributing factors. If you flip over, there's a total of 4 nursing priorities that you can pick from. So I chose the promoting optimal level of function and preventing complications. Underneath that nursing priority, there are several bullet points. So basically, on this part, the intervention and the rationale, that's going to come directly from your book. So just copy and paste it. The nursing intervention is going to be in the plain text, just regular writing. The rationale is going to be in the italics. And then, of course, the response to the intervention is how the patient responds to you doing, performing task with the scheduled rest period to make sure that they don't get tired. So that's just how they tolerate it. So the outcome is the goal. We just have to say outcome because of the scope of practice, I think. So it has to be singular, measurable, have a time frame on it, and specific. So I put walk 5 steps without assistive device by 8 p.m. on 3/2/18. It needs to be within the shift, so that way you can come down here and do your evaluation of income or outcome, sorry. So my goal was not met, or my outcome, however you want to look at it, was not met. The patient wasn't comfortable with using an assistive device or walking without his assistive device. So that's basically it. Like I said, most of it comes from your book, except for, of course, the patient response to intervention and the outcome. That can't be done until after the shift is over, and then the stuff you need on this from your patient. So I hope this helps. Sorry it's late, and I know I probably sound ridiculous and exhausted, but if you need any other help, just let me know.